Yes, I can say that someone cannot choose a specialty just because that was the only specialty they could get in the specialty exam, the residency exam. They should try for their dreams, and I think that if you try enough and you work enough, you will see the results. And you should not get sad or everything. You should not accept something that you don't like. You should always try, and in the end, this will work.
Yeah, I spent, I think, 5 months of Erasmus in Patra, and it
Wow.
was probably the best time in my entire university. It was like a 5 month vacation
Okay.
uh, by the by the seashore, which was also paid for by the European Union. It was just beautiful. I went all around there to visit everything in the south part of Greece, and just a lot of fun. Was
Sounds good.
unfortunately in my faculty you can only do Erasmus once because
Mhm.
there are other people that want, but I got Greece, and this was everything that I wanted.
It's very nice. Actually, Patra is one of the best student cities in whole Greece, or the most
Mm-hmm.
wanted one and known one for party life, for the food, because it's
Yeah,
also close to Athens. It's very popular, and this area is especially beautiful that you went. You did a good choice.
yeah. No, I do. Actually, the university in Patra is not right in Patra, but somewhere like 10 kilometers west of it. Uh,
Amazing.
yeah, but we had a car, so it wasn't hard to go around.
Mhm. Okay, it's nice. I'm happy you enjoyed it.
Yeah, it was. I always enjoy going to Greece, and I usually do that once a year. I think I went to Greece twice this year, this summer.
More than me.
Really?
Yes.
Yeah. Well, what do your parents think that you are going to be a doctor here, so they're going to see you even less often?
They were especially happy when I succeed in plastic surgery because it's my dream and I wanted it since I was a child. So it's I'm sorry. So it was something that they were very happy about me and very proud. But they were very sad also. Like they told me we will try to meet somewhere else except Greece because Iași and Greece don't have a connection actually. So I need to come to Bucharest every time to take a plane, and it's a huge trip that I need
Yeah, I
to
know.
make. So we said we might meet in Italy because there are more flights to Italy, and that we will try to compensate somehow. They told me they will come to see me themselves more often.
Mm-hmm.
So I hope it will work. And to be honest, if I feel too homesick, I will just pause my residency and I will go for 1 or 2 months to get a dose of Greece on my parents, and I will come back after.
Yeah.
I said it. If it's too much, it's too much. I will just take. It's not the end of the world to make a small pause in your residency,
Mm-hmm.
to breathe and come back,
Yeah.
because the hospital is a place that you need to breathe sometimes from, and you know how residency is. It consumes you sometimes, and for me, if I reach this point, I will just get a step back.
Mm-hmm. Yeah, for sure. You must put yourself first.
Yes, but they were happy, very happy.
Yeah, I'm glad to hear that. Now, I know that we discussed this before we hit the rec button, but if you can tell us a bit about your story and how come you came to Romania, and how come you came to Iași, and how come you actually chose to do the residency here in Romania instead of going back to Greece like your father did.
Uh,
So let's start with the beginning.
yes, so me, I finished in 2023 in the English section of Iași. I I had to wait 1 year until my documents are issued by the university and make the equivalence to Greece and everything. So I had it as an idea in my mind to give residency. I heard about it, and I said, why to not start my residency here and equivalate it after in Greece? Because I hear that the general specialties, the surgical specialties are not especially wanted in Romania. So I said, okay, maybe I can get something surgical and after I can go back to Greece if I feel that if I manage to succeed this exam, I have nothing to lose. It will be a nice revision of all the materials I already had in the faculty. And so it started as this in my mind. And I had heard in this point that paradoxically, plastic surgery is not number one in Romania. Like in other countries, it's usually the top specialty that everyone wants to get. So it's impossible to be admitted to have an admission in this specialty. And I heard it. It was a paradox in my mind, and I said, okay, I will try. So it was around August that I started to study about the exam. I thought it would be easier. I thought it would be more chill. I didn't realize how extensive are the materials and the amount of work I would have to do when I started this. But I started to take it personally after some point. I started to work a lot on that, and the more I invested, the more I had to invest more. So I started to study something like 10, 12 hours per day in this point. And I had a burnout after a bit.
We are talking about like 2 years ago when you first tried to take the
Yes.
resi exam, right?
Yes.
And we were talking in August, like you started studying actually 3 months before the
Yes.
residency exam, which everyone can tell you is madness. Because most of the people start like, I don't know, 12 months ago, 12 months before.
It was a bit of ignorance, I would say. I didn't know where I was getting. I hadn't realized.
Let's call it courage.
Okay, and thank you. And in the end, it worked. I had a very good score for my first effort. I had 638 points. Uh, so I felt also a bit of devastating because I knew that I can do it. I felt that if I had maybe 6 months more, I could get even plastic surgery. I liked also to study it. I find it helped me to organize a bit my knowledge, to become a better doctor, to consolidate what I knew, to improve, which I think it's very important when you're a doctor to see a bit the big image of medicine, because when you're a student, you do one class per time, and in 3 years, let's say that it are the medical years.
Specialty.
Yeah, and you're like lost. You forget what you did in the previous year, but this time I had to take everything one by one. And
for sure. Like by us trying to split medicine into all of these different parts, we become short-sighted, and obviously the objective, the short-term objective, is for us to take the next exam.
yes, but maybe I liked it the way it was, the knowledge to be structured, to learn everything again. So I said that, okay, I will take orthopedics this time. It's the closest to plastic surgery, to be honest. I said I might like it. I might not have to give the exam again. It was very interesting and very nice. I had 8 months of orthopedics, but after I felt that I want to try again to get my dream done, to get the plastic surgery. So I paused
So actually you were a resident doctor in orthopedics.
Yes, yes.
Nice.
It was very hard. I had a lot of difficulties because, as I said, I didn't speak very good the language. I was already very tired from the exam. I had to adjust to the hospital reality, which is a hard reality, working and being a resident, and it was very consuming for me. I was constantly extremely tired, and it was a mistake to not learn the language better before I go there. I think that's an advice to all the people that give this exam and to want to work in Romania, that they need to be prepared for that. They should not take the decision like in an instant. They should work on this plan maybe from the 5th year.
Yeah, and even in a surgical specialty such as orthopedics, you still need to
Yes,
know the language to have a
especially
good grasp.
yes, but especially in the surgical specialties, you need to know the language very well. I hadn't realized it, but there's a lot of communication during the operation time. You need to be very clear on how you move. You need to be very vocal in your moves, like I'm moving back, especially in this time. And me, I hadn't realized that I will have to speak so much as a surgical resident. So yes, it was a big change. And then I decided to give it on a second time in yes, again in August. I said, okay, this time I can do it. I speak better Romanian.
Because you already, passed through the curriculum once, so
Yeah,
presumably it would be easier.
exactly. And I felt I know a bit the core of what I studied. And to be honest, I had forgot most of the things I learned during my first effort. I felt I studied most of them as first time. And again, I didn't calculate it correctly. And I wanted to do everything in short time to try everything, which doesn't work. You should always take a bit more time than less time that you need. So again, I was very stressed. I started to see that I will not succeed even when the days were reaching. I felt that I needed 1 month more in order to get the score I need. And in the end, I had 751 points. And
Okay, which is way better than the first score.
yes, it is way better, but not enough. And I could get plastic surgery somewhere in Romania, but if I had 2 points more. So in the
Oh,
end,
wow.
I didn't get plastic surgery last year. So this
Yeah.
time I changed to general surgery because in Greece, in order to go to plastic surgery, I need to have finished 2 years of general surgery.
Oh, wow. So maybe you can actually equivalate. So you take your 2 years here and then you go to Greece and it's like you did your 2 years of general surgery
Exactly.
already. All right.
Exactly. So that was my plan because in orthopedics I had 6 months also that I could equivalate in Greece. So I said, okay, it didn't work. I can try to just finish this time of my residency here and then I will come back. But I felt that I can get a higher score. So this year again, I decided around August. I decided things last moment, to be honest. That's a
So
bad thing for me.
it was already the third year that you decided to take the residency exam in August, 3 months prior. So in total, you might say that you had 9 months
Yes,
of training for your residency
in total,
exam
yes.
in
But
total. Yeah.
it's a very bad idea. I felt very tired. I was bored to study it one more time. I lost my motivation in a big part, but and I was bored as the days were coming for the exam. I felt that I cannot learn more. I felt that I reached my peak, which is a good sign. When you reach there, it's all you did was that I couldn't do more. And in the end, I wrote 840 points, and I passed here as I wanted.
That's awesome. Now, before we dive into how you actually managed to do it and what were your techniques and what was this whole experience for you, I would like you to go back in time and go through why you actually chose Romania and for everyone, because you are the first invitee for the Mindcast which speaks English, and I'm quite excited for that. Hopefully my English is good enough for that, but I'm really curious, and I think a lot of people that watch us, a lot of foreign students or a lot of people that want to be foreign students in some medical university in Romania, to figure why you chose Romania, why you chose Iași, how was this whole process for you?
So I chose it because my father studied here many years ago. Like now he finished at 89.
Oh, wow. Was a tough year for sure.
Yes, just before it became tough, he left the country. So he finished back then. He always had good memories of Iași because he finished here in Iași. He always speak about here, about what he did with his friends. So when I didn't succeed in Greece, he told me, yes, Angeliki, you can go there. It's your other option. So that's how I decided to come here. And it was a nice choice. There are a lot of Greek students in the city, a lot of international students, because we have both English and French section.
French.
There are also a lot of seminars for international students in the city, organizations that make workshops and presentations in English. I was myself also part of the international section of SSCR here. For sure,
Okay. Yeah,
you
that's cool.
heard it. Uh, and we organized a lot of workshops actually for the international people, and that's where I felt that I can do also surgery because I participated in many things. And I worked also with many doctors in the city to organize these workshops for the students. So it was a bit, I said, okay, when you do the surgical specialty, you need to be very good with your hands, you need to like it. And it's not very easy to say this as a student. You sit in the course. But when I
Yes.
started to succeed myself to do sutures and to work on specimens, I really liked it. So I said, I had it as a dream from my childhood, as I told you, to become a plastic surgeon. But I started to see that I can do it in this part of my life.
Yeah, once you had some hands-on practice on that.
Yes.
Because otherwise it just stays like a dream in the corner of your mind, and you still, it's very far from you because you have no contact with it otherwise. And I do believe that indeed medicine kind of lacks on this side of, you know,
On the
manual.
practical part. Yeah.
Yes.
And
Manual
you're
stuff.
always scared. When you make a surgical specialty, it's normal to be scared to touch the patient, that you will do a mistake.
For sure.
It's a way to not be scared. If I can do it here, I can do it also on a human. So yeah, that was a good part. I don't regret coming here to study actually.
Other than that, how was Iași? How do you feel was the faculty there, and were people friendly towards you as a foreigner?
Yes, they were nice. The faculty is good. Actually, I understood that if I was speaking very good Romanian before, things would be much easier for me. It's an advice to all the students that are studying in the international section that once you learn Romanian, it's like you're unlocking a level in the clinic, as people will treat you because you're more accessible when you speak the language. And actually, my life would have been much easier if I was speaking very good before. But it's hard to find also a good Romanian teacher, so that's another discussion. But you need to insist to find someone to help you.
You're
Because
talk you're talking about a teacher that would teach you Romanian from Greek or even English.
English, it's not a problem since you're in the English or the French section, because there are many teachers that speak also French. You can succeed. You can do it from your second language. It's not a problem. Me, I learned from Duolingo, for example, at some point. I
Okay, I had no idea that we have that there is Romanian in Duolingo, and
yes, there's English.
I'm actually quite curious to see how it goes.
It's not the best, but it can help me. It helped me a bit. It's like a hobby.
What do you think about the language? Because I, as a native Romanian speaker, I can say that it's not an easy language, and it's got a lot of exceptions. It's made mostly of exceptions. The grammar is hell, and I'm really curious how it went for you, because Greek is not even a Latin language, so you don't have, you obviously know the Latin alphabet,
Mhm.
but apart from that, everything is
Yes,
different.
it's the vocabulary is not very hard. You can learn the vocabulary quite easy. But yes, the grammar is somewhere that I can be very, very lost. I have That's why when it's on the book and it's a specific sentence, it's very easy to understand it. But if we start to use these little letters from here to there, for sure you are a bit lost.
Yeah.
Me, I learned it from experience in a big part by speaking, by hearing, even in television. I I found some series that actually it in Prime or in Disney Plus. I have it's traducted and I
Mm-hmm.
have put after subtitles down so I could watch something in Romanian and see the subtitles down, and this helped me to understand
Uh-huh.
this really helped me, to be honest,
For
because
sure.
it's about the speed. You speak with a very big speed and with a lot of everyday expressions. So in order to not only understand you, but to process what you say to me, it took me a lot of time. And it's still, sometimes it's hard, especially when I hear lectures or more complex things. It takes me a bit of time to process it in my mind.
And also, I don't know if you noticed this because you obviously you spend most of your time in Romania in Iași, but Iași being a part of Moldova, it's got some accent. Are you able to tell the accent of Moldovians apart from the accent of, you know?
Me, not especially, because in my mind, this is the Romanian here.
Exactly, yeah.
And but I had a friend that studied in Arad, and she
Mm-hmm.
was French, and she came here. And even though she had a very good level of Romanian, she told me, Angeliki, I don't understand what they tell me. The first month she was here,
Yeah,
and
sometimes happens for us too.
but it worked. After that, she got used to that, and she didn't have a problem.
Yeah, I think it would be really cute to listen to you talking with a Moldavian accent.
I don't know. It's okay for me. I got used to it. I don't know. I don't understand what is the Moldavian accent and what is not. I just hear, and if I understand, I'm good. I'm
Mm-hmm.
happy.
Yeah, for sure.
But
Yeah,
people from Moldavia, the country, that's even harder for me. Somewhere there, I'm
yeah, it
lost
is.
completely sometimes.
Yeah, it is. It's got a way harsher influence of the Russian language
Yes,
than you have, for example, in Iași.
yes. I have some colleagues actually in the hospital that are Moldavians, and it was a bit harder to understand with them. But it works. With patients, it can work, everything. The
Yes.
hospital is a place of speed, and the patient sometimes doesn't exist because we need to be fast.
Mm-hmm.
It's totally understandable.
Yeah. Anything that you want to tell, foreign students that think about coming to Romania regarding, I don't know, the curriculum or the opportunities that they have here or the way they are received?
I think it's a nice choice, Romania, because there is a lot of international students. There is a good structure in the university. I think it's a good choice, to be honest. Yes, yes, at least what I know. I think it's the same for Bucharest. Bucharest, it's also a very beautiful city to be.
Mm-hmm.
A capital. Easy to go, not to go around in the city, but easy to go to your country, for example. It's also something that a student needs to consider, but it's a good
Right.
choice.
You're talking about, airplane trips
Yes,
because you got most of them from Bucharest.
yes,
And yeah, you also told me that sometimes you miss your parents and not having a direct flight from Iași to Athens
yeah, yes.
makes
It's
things a bit complicated.
exactly yes. But I think it's a good choice. I wouldn't, if I was going back in time, I wouldn't change it that I came to IAS to study.
All right, I'm glad to hear about that.
I don't know what else I can say to them. That they need to try to learn the language, as we said already, to go to the clinics as more as they can, to do gardas, because that's a problem for us that we have the summer practice in most of the people do their summer practice, for example, in their own country.
Mm-hmm.
If you decide to do your residency here, it's better if you go to this department that you want to go after and see a bit the situation, to see your colleagues, to see how, if you really like the specialty, because every country has particularities on what specialty takes what, how they are like taking care of the patients. So it's important to go to see where you are going after in order
Mm-hmm.
to to know what to expect. So that's an advice I could give to them.
Mm-hmm. Oh, we were talking about language and medical practice. Probably you learned a lot of medical terms which you kind of knew because they come from Greek, right?
Yes, that's a good part of being
Like
Greek.
exactly like the hypo and the hyper and all these.
Everything. Like it's that's the good part of being Greek, that you see the base of everything. Like me, I can understand why this word is there. Even the specialities come from Greek, all of them.
Obviously, yeah.
And it's that's the good thing. But I think that it's not that easy for someone to learn like the basic terms and after some point to make sense to them, like what they are reading in Greek,
Mm-hmm.
what I think. But yeah, I don't know.
Yeah.
It's
All right. Now, fast forward because you already told us a bit about your first resi exams. First of all, how did you you told us? I don't know if you told us on camera that it takes some time for the paperwork to be done after you finish med school. So you said I'm going to try and take the residency exam.
yes. Uh, it's true. It takes around 1 year here in Iași because I know that in other universities it's not the same. I know that in Cluj they make them faster, but here it takes around 1 year. Me, I had my papers done in this in September actually.
Mm-hmm.
Af- So 1 year and 2 months after my actual graduation.
Yeah.
So yes, I had this, let's say, free time. And also in Greece, you need to wait a lot of time until you get a place in the hospital. So me, I was registered. I had done the procedure to recognize my diploma and to start my residency in Greece. And they actually called me to start my residency this May in general surgery. But because I was already working in the hospital and I didn't want to live like that. And I had started to think that I might want to have the residency as a third time. I, I had paused it also in Greece. So
Mm-hmm.
there is a place for me in Greece if I want to go and start general surgery because that's the system of Greece. But I decided to stay here and try one last time to go directly to plastics.
Mm-hmm.
Because for plastic surgery in Greece, I would have to wait something like 7 years to
Oh
start.
wow.
That's the problems of the Greek system.
Yeah, that's a long time.
Yes. So in 7 years, I would have finished here my residency and I will be a specialist already. So that's the good news.
And if like after you finish residency here in plastic surgery, do you plan on staying here or do you plan on going back to Greece, maybe Athens, if you have a place there?
I'm actually planning to go to France
Okay.
and finish. Uh, or in Greece, I will see where I will find a spot. The specialist title is recognized directly to all the European countries, so
Yeah.
I will not have a problem after. I hope I will not have a problem, but
Do you also know French?
yes.
Okay. Oh, and you probably knew French before you came to Romania, right? Because
Yes,
you were
at
in
the
the
college.
English section.
Yeah, but in Greece, as a child, I did English
Mm-hmm.
and I reached C2 level and French and I reached B2 level. So
Okay.
that's why I went to English section. But I'm practicing a bit my French actually right now because I'm hoping to do some rotations in France. And
Mm-hmm.
because there's this program, FFE, I don't know, probably you know about it.
Yeah, but you can also tell us so our listeners know about it.
Okay. Yes, it's like you have an intern position in France and you can do part of your residency in France, and that's a good advantage when you choose your specialty here in Romania, that you can do part of your training there. And that's why actually many French people choose to come to do their specialty in Romania. They have an exam in France, and
Mm-hmm.
they choose to come here to have the exam in Romania. And it's a good choice actually, because you see another environment. There are good opportunities to work as a specialist in France. And if you start your specialty in Romania and you do some studies in France, after it's easier to go start to work in France.
Mm-hmm.
So for me, it's a good choice.
Mm.
This year, the universities decided to change their policy and put some restrictions on the time you can prepare in France or actually abroad. Uh, Iași put it a max of 30% of specialty abroad. For me, that's not a very good thing. Um, of course, if there's a shortage in every department, the department can say no to the residents that wish to continue their preparation abroad. But if there's not a shortage, I don't understand why you should put a limitation yourself. And I know that the same happened in Cluj, and in Cluj, actually, they put it even more strict restrictions. If I read well, they put it 12 months in total abroad.
Mm.
Targumures has 30%. I don't know about all the other universities, but I disagree with that regulation, to be honest.
I don't know. It's maybe because it's like medical schools in Romania are heavily subsidized, so they kind of want to get their investment back and have people actually practice medicine here. It
Yes, but
might be.
if they already have enough residents in their clinic, I don't understand why you should say no to someone that wants to go a bit more time abroad. It's also good for the Romanian economy because a resident requires money. I don't know. For me, if you have a shortage, of course you don't. It's the coordinator's view to
Mm-hmm.
say to you, no, we
Yeah.
cannot. You can go in 6 months. That will be okay. In my point of view, always.
Mm-hmm. Also, I have a question because you told me that you also know French, so you got a bit of support for learning Romania, right? Or
Mhm.
what do you think about the Romanian language regarding to the French language? Because there are a lot of people, a lot of foreign students that speak French natively, and I was really curious to find out if that helps one learn or study Romanian easier once you know French.
I think yes. It's very similar, and sometimes I confuse the two languages in my brain.
Okay, but that I mean that can be a good and a bad thing, right?
And
At the same
yes,
time.
I, if you practice a lot one language, it's going to be like if I speak only Romanian for a lot of time, I forget my French. If I
Mm-hmm.
speak a lot of French, I forget my Romanian. Like they have a bit of but they look very alike. The grammar is similar. They have a lot of words that sound similar. I don't know. They are very. It helped me a lot.
Do you know the percentage of Romanian words that come from French?
No.
Okay, can you guess?
I would say something like 40%.
More like 20.
20.
Yeah,
Okay.
20% that come straight from France, and of course you got a lot of words that come from Latin,
Yes.
which has which have the corresponding words in French.
Mhm. Yeah.
So,
So it's very similar. It's true.
mhm. Okay, now let's go to studying. How you actually managed to study in your three attempts in taking the residency exam. How did it go for you?
So I tried to finish one chapter per time and then to make a grillas on this specific
Mm-hmm.
chapter. Me, if I didn't have a score that worked for me and that I found satisfied, I studied again the chapter and I did again a simulation. So that's how I did it every time. And if I felt that I didn't know something, I insisted on learning on the spot. I didn't let it for later.
Mm-hmm.
Because if you kind of know something and then you go and you just let it go, you completely forget it or you confuse it. So, in my opinion, it's better if you know your materials very well and know half of the materials very well and the rest of them not at all, than to kind of know everything and to confuse it. So I passed everything. What I did actually was to study the chapter one time. If I felt I didn't know it very well, I studied it one more time. I was keeping notes on the things I felt they were harder because I couldn't keep a note on everything. This is very time consuming and it's not very good. I had the simulations, I checked what I knew and what I didn't know. I had a list actually of all the names that I found inside the book and I write them down. If I found some things that were like contradictory, like direct and indirect hernias, I was trying to put in
Put them
a,
side by side
yes,
and try
to compare
to
them.
learn in a comparative way.
Exactly. This is what helped me because these things are very easy to be confused. And if you confuse them, it's very bad because you see it in the exam, you know that you studied, you know that you confuse it. So it takes you down very much on the spot. So these kind of things,
Mm-hmm.
you need to know them directly, which one is what. And I actually did that especially during the last days before I give the exam. I passed again the things that I knew that they were confusing me, the things that they repeat, because there are some parts that are more popular and they really like to put them a bit again and again. So during my last 2 weeks this time, I decided to let the whole book as it is, to not further study something, but go only in these parts that are, let's say, they kind of repeat every year. This doesn't mean that they put the same things, but there are some places in the book that they are very
Mm-hmm.
specific and
Mm-hmm.
very difficult, to be honest. It's like Chinese. What is this and what is the other? And they put it them side by side. For example, hyperkalemia, hypokalemia. Which part is exactly for what? Uh, and yes, that's how I study everything.
But like, okay, your motto seems to have been do it nice or do it twice. So how did you actually manage to get through, all the subjects, because you got three huge books to study and you only had 3 months each time? How did you manage it, except for studying 10 to 12 hours a day, which is insane?
I did approximately one chapter per day. So it was approximately like, yes, sepsis one day, electrolytes the second day. It's very, very, very pussy, speaking about time, but it can work. And for me, it works better if I do like a lot of work in one day, like after the other, in a very, very condensed interval of time. Because I tried also to study during the year and I had forgetting them. Like it was like I never saw them. So this exam is a lot about details and
Mm-hmm.
very specific. You should not know approximately. You should have a general idea. You should have a basis, of course, a core, but you need to know specifically things and to have everything like a list in your mind. Uh, so for me, it helped me to just study everything day after day, to have
Mm-hmm.
some tables, to create my own notes, to make the lists about names. If I felt that something I will confuse it, I had a special list that I was putting it there. Uh, I had to understand everything as I was reading it. So I used ChatGPT a lot to explain me what I was studying, and I tried to visualize the things in my mind. When we speak about anatomy, for example, I was trying to imagine the whole organ and see what is right, what is left, how it moves in the body.
I'm
So
curious, when you asked ChatGPT questions, what was its language? Was it Romanian, English, or Greek?
for sure it was most of the times English and sometimes in Romanian
Okay,
because I had to. I don't study in Greek actually. I have lost this ability since many
okay,
years.
fair enough.
And it's actually ChatGPT is a good helper because you can ask why is that. You should not just read something and be like, ah, yes, this sounds good. You should
Mm-hmm.
understand it deeply in order to go further. Otherwise, you will forget it or confuse it. Also, what
So this
helps,
is your technique, trying to study as logical as possible, so
yes,
that you don't have to memorize anything, but just rely on logical,
mhm,
foundations and relations
yes.
between.
And also the things that doesn't make sense to me because there are some parts in the book that don't make sense to me. Or they don't fit. I had make an effort to remember especially them, like with
Mm-hmm.
because I knew that if I will see that, I will for sure think that there's no way this to be an answer. So I was specifically making a note on that
Mm-hmm.
to because for me it's something that comes logical. It's easy to remember, but if something is completely just appearing there, it's something that you will be confused. And they ask a lot about these things that can confuse you. Or
Mm-hmm.
with the no, like when it says this is not the case,
Yeah.
the book. This is also something that sometimes it's weird to remember.
Yeah, yeah, and it's also confusing for us as native speakers. I can only imagine. By the way, what was the impact? Because you speak Greek natively, and you came to Romania and you studied in English, and like you, everything that you learned was in English, and then suddenly, bam, you had three huge books to learn in Romanian, and even though maybe you were a great student, but still all the information that you had was in English in your head. It wasn't in Romanian. So what was that impact for you?
It was hard, but it worked. I started to understand it partially. And me, I started with surgery, to be honest, to study with that because I felt that it will be easier for me since I wanted a surgical specialty. And they said it's possible. I can do it. It's not that different from English, I think, the Romanian, when they are in the book,
Mm-hmm.
because they use the same sometimes vocabulary. So if you learn some words, you can understand the book without putting an extra effort on translating everything. For me, translating in English and trying to learn in English because I heard it as a technique, it's not a good way to learn for the international students. It's better if you find some words that you don't know, make a small vocabulary list on your own and try to process the things and start to think in Romanian. So I think that's the best way to learn in Romanian. You should not try to think in English or in your own
Mm-hmm.
language and make a whole paragraph in English in order to understand it. Oh, you should work as it is, and it comes if you push yourself a lot. Me, it came approximately in 2 months of work.
Mm-hmm.
And actually, I know many international students that gave this exam and succeed and had also very high scores. So I don't think that it's something that not many people. It's a technique that they use. The people that write these big scores and they are international students.
Mm-hmm. That's quite interesting. So you would say that your brain thinks in Romanian when it studies,
Yes.
or when it studied for this exam specifically. By the way, do you think it would have been easier for you to come to Iași and study medicine in Romanian?
Uh, it's,
Would it
it's a
have
big
been
question.
easier?
No, I think it could be
No?
easier to pass the exam for
Yeah.
sure. But I had a very good time in English sections. I had a lot of friends,
Mm-hmm.
and I don't know, I wouldn't change this part for sure. But for sure, I think I could pass the exam much more easier. And even in my first try, if I had friends that gave this exam, because it's very important to be in a collective environment that everyone studies, everyone tries for something. When you are alone and you try, it's very hard and very, you don't know where you are. If I have,
Mm-hmm.
that's why me personally, I was going to the library to study. I cannot study home. And I had a lot of people around me that gave the residenciat. And it's very nice to feel that everyone around you studies and tries for the same thing and has the same difficulties as you, and not feel that you are
That you're
alone.
the only one
Yes.
that gets through that.
Actually, that's the thing, that even if it's a hard exam, even if the conditions are not the best, because they will change the books, let's say, for next year. But these are the same conditions for everyone. It doesn't mean
Yeah.
that some people will have the books and some others will not have the books.
Yeah, for sure. It's just a huge disadvantage for people that want to start studying, let's say, 2 years before residency exam, and this lack of certainty that they're actually going to use the very same books
It's
on
true, but
resids.
I think it's for everyone. Like if you are in this place, everyone is in this place, and the core of medicine stays the same. If you have studied, let's say, all the surgery yourself, there will be some very common points that you will see when you will study. It will come much more natural to you than with compared to someone that didn't study at all during this time.
Mm-hmm. Mm-hmm.
And for
So,
sure, it's the habit of studying as well. It's also very important to be in the mood to study. And
mm-hmm. So probably you would say that what you studied during the actual med school helped you a lot.
it helped me a bit, but I felt that it was more organized the way that I studied it for residenciat. I studied during COVID, and I had something like 2 years of COVID during
Mm-hmm.
my medical school years, so it was not very productive for me. I was not personally for me. That's how it works. Me, I like to study in the library. I cannot study home, and even if I make a big effort to study,
Mm-hmm.
it's not working very well. So during this time that the libraries were closed and I had to stay home, it was not a very productive period for me, and I didn't have a good base. So I had a big gap in very important classes like cardiology. And when I felt that I studied it completely from nothing for residenciat, and I think it's possible when you have gaps to cover them during your residenciat years.
Mm-hmm.
So yes, I think that everyone can succeed this exam. Like if they study enough, it doesn't matter what you did during your med school years, in which language you did it. If you consider that you can study very seriously for 1 year, I think 1 year is a good time to study actually, and to not be full in the end and lost and stressed. And
Mm-hmm.
I think it's possible.
Mm-hmm. Anything else that you want to tell us about the studying process for you? Like, for example, you managed to get through the curriculum how many times? Once per each exam?
No, two.
Yeah. 2 times?
Yes.
Okay.
Like during, I tried first to finish one time the materials and then to do it one more time. And actually, during my last time, because I was bored, I did it 1.5 because I just left the book and I said, okay, I cannot do this anymore. I cannot do the revision.
Mm-hmm.
And I started to do grillas in the last 15 days. But in the other efforts I did it approximately no, 2 times before the exam.
Mm-hmm.
In my last days, I did 2 chapters per day. Two like not big chapter. When we say about cardiology, I
Subchapters.
did,
Yeah.
for example, valvulopathy and cardiomyopathy, let's say.
Mm-hmm. You said that you were bored. Is this actually how you felt about it, or was it something more deep, something more, I don't know, challenging or
I was,
heavy or
it was heavy because I knew that maybe I will not succeed even this time, and it's the sentiments that keep you down after a point. And it's true that this exam can make you very depressed and feeling hopeless that you don't, that you will not make it. It's a concourse, so if they reduce the places, like it happened this time, last,
Mhm.
you feel a bit that it's going to be even more competitive. Me, I knew these risks more the second time that I gave the exam because I had a very good score, and compared to the previous year, with the score I had, I would enter for sure.
750, you
Yes,
said?
for sure with this score I could enter in plastic surgery with the standards of 2023, but I didn't enter, and this made me feeling the risk that I will not enter also the third time because I knew that the people in 2025 are much more than the 2024.
Mm.
So I knew that it will be something like 10% more hard to get my place. And I didn't know if I'm ready. And also,
Yeah, I
the more
imagine.
time you give the exam, the more sad you are. You're like,
Yeah.
what am I doing here?
Yeah, and especially I can understand the frustration of being 2 points short of getting into plastic surgery the second time you took the exam.
Yes, it's a very big. I'm sure it happened to many students to see your place to live in front of you. That's why they have maybe an ambulance outside the because
Yeah.
I mean this time I saw some places live in front of me, and I
Yeah,
was like,
in case you want to kick somebody's ass, like the one just before you says plastic surgery and you're like malaka.
yes, exactly like that. Or to pass out in the room and I need the medics to come to take me. I don't know. It
Yeah.
was, you start to have the tachycardia in this point that you see it.
Yeah, either one way or another somebody's going to end up in an ambulance.
Exactly. So yes, it's like every day you feel a bit sad. I don't know if you don't manage to do a good score, you feel sad. If you don't manage to finish the materials you want to finish, you feel also sad. I don't know. Sometimes, okay, you might have a good score and you feel happy, but it's an exam that consumes your feelings. Like every day you have, I don't know, let's say
Yeah,
a 10.
yeah, and you never know if you are enough or if you did enough,
Yes,
even when you know that you did pretty much the most of what you could do. Is that enough? Could you actually do a bit more? Would that a bit more? Would that, I don't know, extra 30 minutes would make the difference? Because you probably said, oh, if I knew that one grilla, then I would probably get through plastic
yes.
surgery the second time.
And also, what I didn't saw the second time that I had the exam is that I should be faster because you have some questions that you need to
Yeah.
think and some that you need to answer very fast in order to have chances to finish on time. And me, I felt that I could do better if I had half an hour more. But I because I didn't foresee that in order to have a very high score, you need to be also very fast. And
Mm.
there are some triads, some things that you need to sleep and remember them, not just to remember them. You need to look at the answer and know the answer directly. You should not think about these things. So these things, you need to know them directly, and you need to also take under consideration that you need to pass everything. Me, what I did because I was stressed that I will pass my answers wrong, because I have talked with colleagues, and I have, for example, a friend that she told me that she had the exam two times, and the first time she told me she passed the answers incorrectly for one round.
Oh my God.
So it
Did she
was,
have the time to transcribe onto a second piece of paper?
no, she failed the exam this year. So it was a new fear unlocked when she told me the
Mm.
story. And me personally had printed the booklet of
Mm-hmm.
residency, and I had passed some time to practice on passing answers and making the bullet correctly, and in order to be sure that I will not do that, and to pass them A, B, C. Then I was like A, B, C. Like some nights when I was too tired to study, I was doing that. And it's a hard thing to do. I don't know, people underestimate it, but with stress, with time that passes fast, with your own stress about the exam, it's very easy to start to pass your answers incorrectly. And
once you do that,
yes,
you have to pray that you have enough time to do that once again.
And actually, the good thing is that here the university organizes. We had in Iași 2 simulations.
Simulations, yeah.
That were real-time simulations, and the one that happened by the student association had exactly the same booklet that explained to you how to do them, and it was a very good thing to do. It prepares you for this time, because if you don't know at all and you have already your own stress, I don't know, it's accumulative even more. And I wanted to tell you actually about some particularities that the international students might have.
Yes, please.
You need to have a CNP in order to give the exam. And it's not the same as Romanians. You need to go to the police, it's a special paper. And if you don't have this paper, you cannot give the exam. Even if it writes that you can register with your passport, you cannot register with a passport.
Okay. That's like, why? Why is this thing? It makes no sense.
Because the foreign passports have fewer numbers than the Romanian passports, and you need Romanian. That's actually, I know it because the first time I had a problem with that, and I almost lost the deadline to register myself. So
oh my God.
I tried a lot to get the CNP on time, and most of the students don't know about that. So it's an important thing to...
It's something purely bureaucratical and idiotic.
Yes.
Yeah. Well, that's certainly a good thing to know.
Yes.
For all the foreign students.
It's weird for me, but it's the truth. And also for being to the hospital and get our papers from the police, we need to go earlier, because they take something like 1 or 2 weeks in order to be given.
Oh my God.
They need to contact your home country and get the feedback about you, so that's why.
Like, hey, is this guy okay? And they say...
Yes, exactly like that.
Say ne, and they're like, okay, here we go.
Καλοπεδί, like that.
Yeah. That's interesting. A lot of stuff that I didn't know.
It's small details. You don't have to know, but you just see them in front of you at some point when you try to do the whole procedure.
You want to talk about a bit more about the 2 specialties which you already did, the orthopedics and the general surgery? How were they? How did you feel? What should other people know about them now that you have the experience to talk about them?
Yeah, of course. I think they're both very nice specialties, but what is different is that, for example, in general surgery, you have life-threatening conditions, and for me, it's too much stress to handle. It's not the same as in plastic surgery that, of course, you can have life-threatening situations, but it's not every day. It's sometimes. So for me, it's not very close to plastic surgery itself, but it's very interesting. And for orthopedics, it's very nice. I felt actually very sad to leave orthopedics because I liked it a lot, but you need a lot of physical force. And for example, in Greece, you can work on small articulations and hand, but here in Romania, it's only the lower limb that it's for orthopedics, and they don't actually work a lot on the hand.
That's because in Romania at least, the hand is part of plastic surgery.
Yes.
Which is, I think, is quite great for you, right?
Yeah, I like it a lot. I liked hand surgery. I had my thesis on actually the hand, So when I choose orthopedics, I thought that, yeah, okay, they will probably work much more in the lower limb, but they will have a bit of the hand. But
Mm-hmm.
it's not going like that. But it's very nice. But you need a lot of force, and for a girl, especially if you're a bit small as a girl,
Mm-hmm.
it's not working very well. And but of course, there are great orthopedic surgeons that are women. Uh, and I don't know what else to say
Well,
actually.
yeah. What are the, I don't know, the surgeries or the procedures where you feel that a lot of force is required? Because I think the dislocation of the shoulder, I believe you need some force in order to put it back. Apart
For
from that, is just anything involving, I don't know, a chisel and a hammer.
for sure, but me, I was in an orthopedic hospital. I was not in a traumatologic hospital, so I
Okay.
didn't have night shifts. But I had
Mm-hmm.
a lot of prosthesis of the knee and the shoulder.
Mm-hmm.
Of not the shoulder, the
The hip.
shoulder, the hip. Exactly.
Yeah.
I have lost my English ability a bit these years.
Yeah,
And
I imagine.
for example, the hip requires a lot of force, and
Mm-hmm.
uh, and the knee requires a lot of force, to be honest. And for example, me, I have force, but I cannot control this force, and it's an important factor when because a man can control his force much better when we speak about big force.
Mm-hmm.
So yes, I think it's a very nice specialty, but it's hard to follow. And also the
Mm-hmm.
schedule, it's I think more after you finish your specialty, you have a schedule much harder in these two specialties. Especially in general surgery, you're working very hard until your late age. And for me, this is admirable. It's a lot of responsibility. It's amazing, but not everyone can do it. Not everyone can get this kind of responsibility, this type of
Yeah. Of
yes,
commitment.
commitment exactly. And me, I want to open an office after some years. I want to be a bit more chill. I like a lot
Mm-hmm.
reconstruction, for example, that it's part of the plastic surgery. I like a lot burns. I like a lot many surgical parts, but I couldn't do this, let's say, every day. I would like to have my pauses. And some specialties don't let you to have a pause after. So I think that's something that you need to take under consideration when you choose a specialty. The same is for internal medicine. I don't think that people that are in internal medicine take a pause in their life or um, I don't know, even IT. If you work in a hospital, you don't exactly take a pause. For me, they have a very big responsibility when they have a patient. And it's not for everyone, this kind of stress.
Mm-hmm. Yeah, for sure. You said that you took your thesis in hand surgery
In
and
carpal tunnel syndrome.
yeah, or how we call it in Romanian, dizertație. How was that for you?
It was nice. I liked it a lot. I started to see a bit myself in the hand surgery at this point. I had seen also during my summer practice in Greece a lot of hand surgery because we don't really see it in the faculty. It's a bit complicated. We don't go in detail. So doing this in detail made me think that yes, I could do that. It's
Mm-hmm.
small surgeries, detailed, and I liked it a lot. It had statistics, my paper, which I kind of regret because it took me a lot of time to make it. If I was changing something, I would ask from my teacher to take out the statistical part because I was
Mm-hmm.
working on them for 3 weeks. And especially if you want to give residency, you cannot have a thesis that takes you 3 or 4 months to prepare. It's better if you relax and take a bit your time to study and to yourself. If you focus on other things during your time that you should study or
Yeah.
relax, after that, the tiredness doesn't go away.
Mm-hmm.
So I would say that it's nice to choose a thesis on what the students like, of course, and what they want to follow, because it's good to have it also for your CV after. But in some conditions, like if it didn't have statistics, it would take half the time. So I think, or to finish that thesis in the fifth year, that's also a good solution,
Mm-hmm.
because it's possible to finish it during the fifth year and to not have it in your sixth year to occupy with it. But for
Yeah,
sure, the sixth year is not the year to make your thesis. And
I think most of the invitees that I had here in Mindcast, if not all of them, said that one must begin working on their thesis as early as possible so they can have as much time as possible to just focus on the residency exam.
yes, it's like when you try to do everything, you end up to do nothing. It's better to focus on one topic and do it very good.
Mm-hmm.
So yes.
Yeah. How were the how were the last weeks before the last residency exam for you? How did you feel? Did you feel like the stress was overwhelming? You said that if I'm not getting plastic surgery this time, I'm just screw it. How was it for you?
And it was actually this last year, it was kind of okay. I had to make peace with the fact that I might not do well. I tried to study as much as I could, but I was, I felt that I knew a lot of things already, so I wasn't very stressed, and I had come in peace with the results that might come. I tried my best. I finished, I started to do the old things, the old topics of the exam again and again. And I wanted to be sure that I know everything perfectly. When I saw something that I might not know this well, I was going and I was rechecking it to be sure that I know it
Mm-hmm.
naturally, not only if I think about it or that I'm so about it. I wanted to be sure about my answers and that I know them very well. So actually, that's what I did. I did this last weeks. I left the revision aside, and I said now I will work only with gorillas and only with the things I need to specifically revise to be ready for my
Mm-hmm.
exam. So I went there. I saw some parts that were a bit more complicated. I noticed actually that a bit more the logic of the exam, that if something is not the answer, it belongs to something else that already exists in the book. It's not something completely new.
Yeah.
So I went and I saw, when I read the old topics, I went on the paragraphs around and I saw from where does this answer come from. So it's like I made a more extensive revision of the things. I was a bit disappointed also because I had making the same and the same mistakes. Sometimes I felt that it's not possible. I don't progress. But
Mm-hmm.
actually, when the time came of the exam, it was these things that I found them with easiness, and it wasn't very hard because I felt that I saw a lot of the things already the previous days, and they were very familiar to me during the exam. That's why I was like, okay, it's not possible. These things I saw them yesterday. Like I didn't do a pause in my last day before the exam. I stayed and I studied all day long. I know that most of the people choose to take a day off or 2 days off before the exam. I'm too stressed to do that, so I stayed there and I studied it.
Mm-hmm.
And I had made a little book with the things that I confused again and again. And I compared the information like side by side. And this actually helped me a lot during the time of the exam because I was making this little booklet for 15 days. And just the afternoon before the exam, I opened my booklet and I saw everything again. And it was exactly the things that fall in the residencia, to be honest. So for me, it was the best choice I did.
Mm-hmm. Was it hard for you to balance studying for the resi exam while being an actual doctor and having a job and having to be in the hospital a lot of
Yeah.
hours every day?
Yes, that's why I stopped work. I couldn't do both, and I said that it's better if I stop to work for a few months
Mm-hmm.
and sit and study as I should than to try to do everything and be very tired in my work and not studying as I want. So me, I don't believe in the work and studying balance for residency yet. I believe that you should stop to work, sit and study and focus in one thing if you want to succeed. If you want to, if someone can do both, I'm admiring them. But for me, this doesn't work and it's exhausting. And you feel useless in me. I felt useless in both these things because I really tried it at some point. And it's not the end of the world to take a pause during your residency and do something else if you feel like that. Okay, with money, it's a bit hard because you don't have money when you start to work. But me personally, I asked a bit help of my parents. I had kept some money during the whole year because I was thinking that maybe I will need them. So I think it's manageable to do it that way. Me, I like to start to work in the morning and I reach around the 10 to 11 hours per work per day. Uh, I had a very strict schedule on the time I was waking up and I was sleeping, and the time I was eating, even the time I was drinking my coffees. Because if you drink too many coffees, you don't sleep well at night, and you need a very good sleep in order to rest and get the best positive results. Because if it's a marathon, it's not a speed, because
Yeah,
you need to do it every day. So if you try yourself like to the limit, in the end you cannot learn more. You get full with that. So like me, I tried this year to be as equilibrated as possible. Even the amount of water I was drinking every day, it was specific because I tend to forget to drink water when I'm studying. I know it happens to a lot of people actually. I have, as far as I have discussed it, and in this time, I try to eat very nice food, very healthy. And I think that when you study for this exam, you need to be very good prepared, like every day. You need to have no distractions, you need to have no drama, you need to have, you need to study. When you study, to study, not just stay in the desk and think you're studying. Because it's actually a thing. I had it myself when I was trying to enter in Greece in the medical school. I was standing in the desk because I felt too guilty to just not study, and I thought maybe in my mind I was studying. What you need to do is when you sit to just do that, to not occupy with other things, to not occupy with your phone. You need to make a break from your life and focus only on that. That's what I did.
Mm-hmm. And you managed to have your sleep under control by not drinking the coffees which you normally would. How were
Uh,
your, I don't know, the food, and did you do any sport? Did you
no,
take care of that part?
no, I didn't have time to move, especially. I tried during my first, no, during my second time I gave the residency up. I tried to go to the gym and try this approach, but I was too stressed to actually do it. So this year I said, okay, I will not do nothing. I will just
Focus
because
on that.
yes, with food I try to make simple but healthy recipes.
So you actually cooked?
Uh, a bit salads, these kind of things, like simple things. I didn't want to spend more than 40 minutes in the kitchen to cook my meals.
That still counts as cooking, as opposed to ordering food or
Okay, yes, it's true.
yeah.
But I try to have some supplements that help me to work better and sleep better, like omega omega 3, magnesium. Sometimes if I couldn't sleep, I was taking some melatonins. What else did I take? I took Q10. I took some multivitamins. So I have vitamin
You
D.
you think those actually helped you, or was it
Yes.
more like a placebo?
No, I think they helped me actually because I felt a difference from last year that I didn't take anything and I didn't believe in the power of supplements. But this year they really helped me and with my sleep and with my studying. And I took only one coffee per day, like around two. And after I didn't drink any coffee in order to sleep well, because if I didn't sleep well, I knew that
Mm-hmm.
I will not do well the next day. So I
Yeah.
should be, the most important is to be productive the next day as well, not just the day that you are.
So, how was the day prior to the exam for you? You said that you couldn't take a break, so you
No,
just went on and kept
studied.
doing grille.
Yes, actually I didn't do grillas because last year I did grillas before the exam and I ended up crying and saying I will fail tomorrow, I know it. And so I said no more grillas after some point. And I just did a revision. I saw the things I had noticed in my little book one last time.
Mm-hmm.
I stopped to study around 8. I ordered food to celebrate that it's the last night before I give. And I was a bit happy that finally it would be over, no matter the results. I was stressed a bit, but it was okay. I didn't drink coffee in order to be sure I will sleep the night and I will not be too stressed and miss my sleep about that. So I slept very nicely.
Okay, that's good.
And yeah, I was stressed on that day because maybe the things wouldn't be as I wanted. Not only about the exam, but the conditions of the exam. Because last year, when I had my exam for second time, I realized that the desk was moving very much. So I didn't want my desk to move in order to be sure that I will not go outside the limit.
Mm-hmm.
During my simulation that I had, actually, by mistake, I went outside the limit.
Mm-hmm.
So I was always, and three answers got cancelled when they scanned my paper. So I understood that if I do the same in the exam, I will miss three answers, which is 15 points.
Yeah.
So I was a bit stressed about this. I wanted to have the optimal conditions. I wanted to have the best results. To not.
Did you pick your own desk?
I checked first if the desk was moving. It was moving because in the amphitheater it was just behind someone. So when this person was moving, my desk was moving as well.
Uh-huh.
So I just asked,
Can I
and
have another
yes,
desk? And they were like, what
yes.
the fuck?
I don't know. For me, it's logical. I need to have a desk that doesn't move.
Yeah,
It's
obviously.
it. I had give 2 years of my life in this exam. I didn't want to lose it because someone will move me at least the time I was putting my answers. I know that maybe it sounds a bit paranoid, but I don't know. I
I mean,
didn't.
I get it.
Yes. So yes, that was the thing. I was stressed until I give the paper because I was afraid something will not go well. I knew when I was seeing the answers that I will have a very good score when the time will come. So I was I just gave it and it was okay. It was nice. I saw actually in my room there were very high marks from my colleagues, which is very nice, of course. But I was thinking that maybe this year the topics were very easy and everyone had very high marks. So
So
maybe
you
my
also wouldn't get it.
yes. So until I see the classification, I was in very big stress, even if I had a very good score. I see. I saw that they gave some more places in plastics in some cities, so I knew that probably I will get plastic in a city, but I wanted specifically to stay in Iași. I didn't want
Mm-hmm.
to go somewhere else, to be honest. My boyfriend is here, so
Mm-hmm.
For me, it would be a bit pointless to move around in Romania. I know that it would be hard to come here and see him. I would be far from my family, far from my
Yeah.
boyfriend. It would be too much for me. So I had a very big stress until I see my place and be relaxed.
Mm-hmm. How was it for you to see the subjects for the third time? Did you have the same kind of stress? Did you, I don't know, did you recognize some of the questions given that you did a lot of relay in your training?
It was, I recognized most of them. I felt that was seeing,
You had the deja vu.
yes, I found that I wasn't sure if they put it again, like the same answers or something. I was surprised, to be honest. I found it easy this year. I know that it might sound, I don't know, weird to say, but I found it very familiar. So I knew that
Mm-hmm.
when I was solving it, I knew that I will have a very high score. I I wasn't sure if it would be enough because it's a concourse, so it depends also what the other people around me are doing. If I find it easy, maybe the people around me find it as well very easy. And that's the trickiest part. It doesn't matter if you have 800 points. If everyone around you have 800 points,
It doesn't help. Yeah.
it doesn't have a value. It's very nice that everyone had a very good score, but what is a good score if you don't have the place that you want?
Mm-hmm.
And I learned this the hard way, like last year. And this year, actually, there was an explosion in the scores for this reason, because the materials were the same for many years and people started to study much earlier. And the people that want to have a very high score have started to study much earlier. So it's normal to have a lot of very high scores, in my point of view.
Mm-hmm. So
Apart
did you celebrate your score once you saw it, or did you think, nah, just wait until the repetition?
I
So
said
why?
I was waiting until the classement. When I saw the
Mm-hmm.
classement, I said, okay, now he can party.
Okay.
It's for sure I get it now. But when I saw the score, I said, okay, maybe everyone had more than 850 points. I saw a lot of discussion about the fact that many people had very high scores, that in Bucharest people wrote very high scores. And I said, I don't want to be too positive until I see that everything is okay. Even now, I'm a bit stressed because I
Even
don't
now.
I don't know. I'm having. I can't believe that I actually made it, and I will get plastic surgery, and I will start to work. And I don't know. It's something
It's
I dreamed it for too long to have it.
mm-hmm. And your brain is still in that mode of
Yes,
stress and
yes, yes. It's exactly that point. That if I don't know, maybe I will get it when I will start to work there, and I will process it a bit more. But for the moment, it's
mm-hmm.
very happy news, but I cannot process it.
Yeah, for sure. Now, apart from the obvious experience of working as a doctor in the 2 years which you did this, is there actually a benefit? Like, I know that you got these stages, or however they're called in English. So, will some of those be equivalated so you finish your residency in plastic surgery earlier because you already did some of those?
Yes,
Did you?
actually, it's I if of course my coordinator agrees on that because it's also the coordinator's decision. I can
Mm-hmm.
equivalate 1 year.
Okay, that's not bad.
I try to do some modules that were common between these specialities.
Ah, so you actually thought that this is going to
Yeah,
happen. So you
yeah,
planned in advance. Nice.
a bit. Yes, I had it in my mind. Me, I like to keep all the doors open. I like to keep all the scenarios. So I had it in my mind that
Mm-hmm.
maybe it can happen. So I
Yeah,
did.
nice. Nicely done.
So yeah, but it depends a lot also if my coordinator will agree on that because it's a common decision and I know that it's a lot of time that I did and I actually did also 2 months in the plastic surgery. I wanted in the department. I wanted to go to see if it fits to me and if I really like it. And because being a student and being a resident is two different things. It's very nice to see a very severe case when you are a student and you don't have any responsibility about it. But when you are a resident and you're actually there and you need to help this person, it's much different. And for me, it was a big change. So I wanted to see where I'm going and if I can actually get the pressure of the specialty. And I liked it, to be honest. I found it a very nice department.
Mm-hmm.
But I will see if I can go there because in the repartition, you have in the small repartition that it's after the big repartition, you choose the coordinator and the hospital. So actually, I'm not in the place to choose myself what I want. It depends also on my colleagues that had the highest score than me.
Mm-hmm. Do you consider yourself lucky, or do you think that luck had any impact on your trajectory?
Uh, I think actually that no, I was a bit unlucky in my choices. And because I had, no, not unlucky. I think that there was not a lot of impact because I have worked a lot for
Mm-hmm.
coming here and succeeding my exams. So I had studied a lot of time. I have put it my best. These last years, I had tried a lot to improve my Romanian and to work on my residency. So I don't think I had especially luck. I had luck because I heard that I can, and lack a bit in the help I had from other students to hear that because in order to choose to come here and do my specialty, I spoke with some people and I saw that some people succeed this exam. So hearing that there are international students that had a score of 800 points plus, for sure it gives you motivation and it makes you to choose this path. So if we take it from this perspective, I had luck. And I
Mm-hmm.
saw many people succeeding, many people giving a second time and succeeding the specialty they wanted. Because for sure there are Romanian people that work a lot and succeed and have 900 plus points, but you don't know about the international students that do have a good score and succeed in the specialty of their choice. So when I heard for some colleagues that actually did very well in the exam and succeed, it gave me the idea to follow their example and to see that it's possible. Here in Iași, we have many actually international students that succeed. I don't know how it is in the other cities, and if they try, I know that it gets more and more popular because in France they changed a bit the regulations, and there are more and more French people that are having their exam to get a specialty here. And in Greece, we have a lot of doctors, so the waiting list is getting bigger and bigger. So many people would try their way somewhere else. And Germany also has difficulties in order to be accepted, and they ask more and more things. And when, in order to work as a doctor and choose your specialty, it gets harder, you will try also other ways. And in Romania, you finish here, so you know a bit the system, you know a bit the language. So you see that there is like, for me, what was the most positive and it made me to choose it, it was that I saw that it's a straight line. Like you succeed the exam, you get the specialty, you become a specialist. In other countries, you need to try a lot, to try other specialities, to change. In the end, I didn't
You
have a
you need
straight.
to apply individually to
Yes,
hospitals as
yes,
you need to do
exactly.
in Germany, for example.
Exactly. So for me, learning German, because it was my option also. My parents told me if you want to go to Germany,
You speak like 5 languages?
no, no, I don't speak, but my parents told me if you
Okay.
want, you can go in Germany and learn German and try there your specialty. But me, I said I don't like this uncertainty that I will stay, I will study German, and maybe I will not get the specialty I
Mm-hmm.
want. So and also the German language is a huge
Sehr schwer.
factor. Yeah.
Yeah.
I don't know if I could learn them, to be honest, but that's why I said I prefer to study for an exam and succeed, and that's it, than to go and hope I will succeed. Like, if I find the right hospital, you understand what I mean.
Mm-hmm. Yeah, for sure. There are some advantages of being a doctor in Romania, and following this whole path of taking the
Yes.
maybe the admission exam, or doing the med school in Romania and then taking the residency exam. And I'm really glad that I talked to you, and I find that your story is truly inspiring, because you took the residency exam 3 times and you succeeded. Do you have anything to tell to the people that perhaps didn't take such a huge grade the first time and they feel discouraged? Because I think it could be inspirational for them to learn about your story and learn that if you try enough, I don't know, eventually you're going to reach to your goal.
Yes, I can say that someone cannot choose a specialty just because that was the only specialty they could get in the specialty exam, the residency exam. They should try for their dreams, and I think that if you try enough and you work enough, you will see the results. And you should not get sad or everything. You should not accept something that you don't like. You should always try, and in the end, this will work.
All right. And as for the last question, if you were to go back in time, let's say 3 years
Okay.
or 4 years, would you do anything different?
Yes.
What would that be?
I would have started sooner, for sure. I would have made some classes to be more prepared for the Romanian language. And I would have started for sure to work on residenciate earlier, because if you leave something for last moment, it can always go bad, and you can always get too stressed for something that you wouldn't be stressed elsewhere. It's better if you succeed the first time, not the third time. Like, not because that's it, because it's a lot of burden for you. I can tell you that I felt these times that I tried, it was not the stress of studying. It was not that I didn't like to study, but I was always very sad that maybe something will not go as I wanted. And I think if you have started earlier, you can prevent this kind of situations. So that was the only thing I would change, to be honest.